According to Kern County Department of Public Health, approximately 1 in 7 African American babies in California are born too early or too small. But that is why a local health program has services on hand to assist African American mothers during their pregnancy, labor, or delivery stages. 23 ABC's Brianna Polk joins us live in East Bakersfield to provide more insight on how the Black Infant Health Program is supporting African American mothers who are in need here in Kern County. Brianna.
With the culturally supportive environment and honoring the unique history of Black women, expected Black women in our community are able to interact with those in their same situation to build a sisterhood.
We do offer actually both group sessions as well as case management. The group sessions consist of 10 prenatal group sessions and 10 postpartum group sessions. And then our case management, it actually mimics the group model. However, those case management sessions are more condensed.
Fila Batiste, maternal, child, and adolescent health coordinator, says that these sessions cover a number of topics, including cultural heritage, healthy pregnancy, labor, and delivery, among others. She adds that the pandemic did not stop the program from being a helping hand.
Since the pandemic, the program has continued to thrive, and it may have done a little bit better, especially the fact that, moms are able to be in their homes and to join virtually.
The program not only focuses on the health and wellness of the baby, but also sets up the mothers for life after they conclude the program. The personalized life planning sessions encourage them to set short and long-term goals within their personal lives.
We go over life planning for the mothers. We also cover stress management for them and how to have healthy relationships, communication.
Fila tells 23 ABC that the program has made a significant impact on the mothers, as social and economic stressors play a major role in poor birth outcomes.
We did a sample of some participants, and that showed that on average, women attended 7.2 out of the 10 groups and 5.1 of the life planning sessions. And that's a significant change where they improved in 13 of the 18 intermediate health and health-related outcomes that were examined in that sample.
An evaluation of prenatal program implementation and outcomes was conducted for participants back in 2018 and found that more than 90% of the women agreed that the program helped them build stronger social connections, manage stress, as well as set and achieve goals.
We are here to serve you. We're here to help you, to encourage you, to strengthen you.
Batiste says that in order to enroll into the program, you must be 16 years of age or older, identify as a Black or African American woman who is either pregnant or up to 6 months postpartum. For more information about the enrollment process, you can head over to our website at turn223.com. Live in East Bakersfield, Brianna Polk, 23 ABC News, connecting you.